Okay, Daryl Baskin here again with the San Antonio Ophthalmology course review for Retina. We're getting to towards the end, a couple sections left. So we're going to talk about right now laser therapy, cryotherapy. Actually, not so much about cryotherapy, just laser. This is the shortest section. Basic principles of lasers. Photocoagulation, we're using light energy to coagulate tissue. The light is converted to thermal energy. The tissue temperature rises above 65 degrees Celsius. That's a nasty typo. Current systems span visible spectrum and venture into infrared. Can be delivered in a variety of ways. Transpupillary, which sounds fancy, via slit lamp or laser indirect ophthalmoscope. Endophotocoagulation during pars plana vitrectomy, for instance, or transscleral laser via contact probe. And then let's talk about pigment absorption for lasers. We've got melanin, which effectively absorbs green, yellow, red, and infrared lasers. Xanthophyll, which effectively absorbs blue, and then minimally yellow and red. Hemoglobin easily absorbs blue, green, and yellow, minimally red. So using a red wavelength laser can be effective in treating retinal tears with dispersed vitreous hemorrhage when the green laser is ineffective. The reality is that most people only have access to one, maybe two wavelengths of laser these days. When I was a resident, we had some lasers where we had like green, red, and yellow. We could pick which one. And nowadays, most of them are yellow lasers or green. Or a lot of people have a diode laser for ROP. And you could potentially use that if you had to. I will say it hurts like the dickens. We had 2 diode lasers when I was in Afghanistan. I don't know why. And so that's what we used. So accidental foveal burns is a laser complication. We talked about these earlier. Brook membrane ruptures, increased risk of CNV, full thickness retinal holes, ouch. Epiretinal membrane formation, progressive atrophy of the RPE. And then that's basically the laser scar expansion. Subretinal hemorrhage, choroidal ischemia, chorioretinal anastomosis, and then exudative retinal and choroidal detachment, some bad stuff. We didn't mention there you can actually get pupillary abnormalities from hitting the ciliary nerve and pain. Did we mention pain? There's a lot of pain with these. Photodynamic therapy is FDA approved for CNV due to macular degeneration, histo, or myopia. It's most commonly used these days for central serous and some ocular tumors. It's an intravenous injection of a photosensitizing drug called verteporfin, Visidyne. And you activate the drug with laser, and then that leads to a formation of reactive oxygen species, free radicals, causes endothelial damage, platelet adherence, vascular thrombosis, and capillary closure. Sounds really bad. You're putting a dye into somebody that sensitizes them to light, and then you're giving them a sunburn. It's the way I explain it to patients. And they literally can't get a sunburn if they go outside because it's going all throughout their body. Severe vision loss is like a 4% risk in patients with AMD. With central serous patients in a thick choroid, the data is just not there to support that being a real risk. Scotomas, back pain, it's like a 10% back pain risk. It's really strange, and it only goes on during the course of the infusion. And we just finished our section on laser. So remember, always wear your eye protection. Thank you, and bye for now.